I don't think we have all the time that is needed, but this will be a start anyway.
Great.
So welcome. We have to say welcome. Gavin and Anne-Marie.
Yes. And the first question we want to ask is what type of healthcare setting is Reiki currently used? Do you know?
So yeah, all over the place. So we're in hospitals. We have something called social prescribing. So GPs in the UK can prescribe Reiki as a treatment for registered Reiki professionals. We're in animal settings as well. So in medical settings for animal usage as well. Hospices, so pretty much anywhere where there is a requirement, either preventatively or as a therapy as well. We're pretty much in all of them.
Now, what was your first step? Where did you first?
Well, we weren't the first step. Something called the core curriculum was created in 2009. So that was the standard at which Reiki needed to be taught at. So it couldn't just be you could teach Reiki however you wanted, you had to follow this core curriculum. And it's a minimum 9-month course with set amount of hours, set amount of case studies. And once you've completed that, you then go through another step to become CNHC verified. The CNHC are a government-backed organisation funded by the government, paid for by the government, and they've approved a certain amount of therapies, of which Reiki is one. To practice in the NHS, our healthcare system, or privately, you need to be CNHC verified if you want to practice in those places. So you go through one of our organisations, we're one of 3, then you go through the CNHC. Once you've completed that, then you can apply to work in a healthcare setting. So it's all about the standards, all about the training.
So what is needed for a Reiki practitioner?
So it's not vastly different. So the structure that we all have in the traditional Usui. So it's an important point to raise that the standards that are agreed in the UK are based on the original Usui training. They require face-to-face attunement. So online initiations and attunements don't fit the criteria. Or theory, absolutely. So it's all about the face-to-face process. As Anne-Marie referenced, so in 2009, the first core curriculum was put together. It's evolved over time. I think the last one was completed in 2018? 2023, brilliant. So another update. So there's a group of organisations in the UK called the Reiki Council, of which we are one. So that was put together with the CNHC. So it's not vastly different to what in fact, not at all different to what we all know as Reiki training. It's about those standards, it's about those hours, it's about that time consumption. So again, the recommendation behind a great course would be at least 2 days of training for Reiki 1, at least 2 days of training, this is physical training in the first instance for Reiki 2, but over a period of 9 months with a certain amount of hours and case studies to be written as well. So there are 2 ways of achieving this. We have what we call accredited courses in the UK. So if you go and study an accredited course, that's a much easier route because all the work has been done to look at that course to make sure that the content is correct, the amount of hours is correct, and that the teacher is signing you off to a good standard. So that's the easiest route, is to finish an accredited course. The other option is, if you've already done your training or if you're working with a teacher that hasn't got an accredited course, you can apply, and what we have essentially a series of questions that we have to ask. It's quite a long process, but it's not particularly difficult to do, and there'll be case studies that you supply to show that you have understanding in each of those areas. So you understand the physiology and anatomy of the human body, you understand working with people, you understand the consent sorts of forms you need to be completing as well. So all of that is built in to a certain level of quality throughout the whole way. So it's important that people are working to that standard.
So who did set up those standards?
So that was the Reiki Council work with
where you were
the
a part of.
CNHC.
Yes.
Absolutely.
Yes.
So in the UK we have a number of Reiki organisations.
Yeah.
We are the largest by
2000
quite a
I
lot.
heard.
We are.
Wow,
In fact,
really?
I've just checked the numbers
Yeah.
actually, thinking that we might be asked. We're at 2007 as of
Wow.
right now.
Good.
So
That's wow.
and it's great, and we're really getting some traction. So we're growing by sort of a net figure of about 30 every month. And it's carrying on an upward direction, and we're seeing lots of new different types of people from all sorts of backgrounds that are joining. But yeah, so there are multiple groups, and we work with them. So we have 6 to 8 meetings per year with the other Reiki organisations as the Reiki Council to agree what those standards should be, and to make sure that inside the UK we're all singing from the same song sheet and we're all following the same standards.
And within the CNHC, we have a Reiki-specific education board, which I'm luckily part of, so we get to know what changes will come as well.
Yes.
So it's always about elevating the standards, always,
Yeah.
making it stricter.
Do you want to?
We would like to know about insurance and background check. Do you have
So-
something like that?
We've just introduced DBS checks, they're
Yes.
called, only just.
Yes.
We were the first Reiki organisation to introduce it. I've wanted to introduce it for ages, but we've needed the right team in place, and we've got that now. So you don't have to have it. You do in a medical setting, but the medical setting will arrange that for you. Insurance, everyone insures Reiki in England. Everybody, it's easy to get.
Yeah.
But you have to have it.
Yeah, and there are lots of complementary therapy insurers that specifically work in that space, and we have a partner that we work with, and we're at a festival in London next week when we return, and they're going to be one of the partners on our stand, and we have a sort of a catchphrase in the UK Reiki Federation, which is for every step of your Reiki journey. So again, all the way through, we encourage. In fact, we actually, with Balin's our partner, we offer free insurance to all of our student members as they join, so they get free student
To
insurance.
encourage.
Yeah, to encourage
Professionalism.
their professionalism and their learning all of the way through. At which point, when they're then qualified as practitioners, they purchase their insurance. So we don't allow a practicing member of the Reiki Federation unless they can supply a copy of their insurance certificate. They're not allowed to join.
So who is owning the database with the people that are not qualified to do? Is it this council or is it CNF?
CNHC.
Yes.
Yeah.
That's
So
awesome.
we have our own database of all of our members and past members and anybody that we've verified as being CNHC qualified. Now they don't have to keep that registration up with the CNHC, so they can choose to let that lapse and then renew at a later date, and we've got all of the historic information about what they've submitted, how they qualified, so they could theoretically apply again after a period of time. So we have our own separate databases.
In the UK, all doctors, dentists, psychiatrists can access the CNHC register and refer patients to practitioners.
Do they get paid, the Reiki practitioners, or
Absolutely.
volunteer? No?
It's a bit of both
It's
in
both.
actual fact,
Both.
yeah.
Yes.
So for 3 years I worked at a big London hospital and I was paid.
Yes.
And paid appropriately. It was a mid-range nurses band, so it was well paid. But there are lots of volunteers too.
But were you employed by the hospital or are you your own? And
So
then,
no,
yeah.
it was a funded group supported by St George's Hospital called Full Circle Fund Therapies. Their budget came from partly the NHS, so we were paid through that budget. But we had an NHS contract, so we were employed by the hospital.
But in lots of hospice environments and other care settings, there are still lots of volunteers that are out there doing it. Partly to get their qualification hours up as well, because that's really important as
And the
you're moving through.
experience.
And the experience. I mean, I think
Yeah.
we probably all know, there is the ability to train as a master and you get a master certificate, but we're never really masters. We know a bit more tomorrow than we knew yesterday and so on.
Yes, that's right. So could you please share some success stories and pitfalls, because we don't know what if we can ask you, so we don't do the same.
Success
Yeah.
stories.
And I think from a success story point of view, having that CNHC qualification is really
Yes.
important.
Yeah.
We've been working with, some of my other BIG colleagues around the room will know, Romania are getting very, very close to having something similar in
Yeah.
situ at the moment. They just had a recent change of government which has slowed the process down a little bit,
Yeah.
but it was really about getting the individual Reiki organisations together and agreeing those standards and pushing to have that central agreement. You know, once that's written down on a piece of paper, it's very difficult to argue with it. So I would say the biggest single achievement is really about having that core document
Yeah.
from a group of people that all agree. And we don't always agree, of course we don't. You know, we work
That's why you're a
respectfully.
separate organisation.
Absolutely,
Yeah.
but we work respectfully with each other and we collaborate to get a document that we can all sign off on and agree as a minimum standard.
Pitfalls, can't think of any pitfalls. I think the UK is so receptive to Reiki now. It's mainstream. So if there were pitfalls, there aren't any now. Doctors and nurses completely understand and respect Reiki. They
Yeah.
love it in acute medical settings. Absolutely love it. And the research that's being done in these London hospitals is second to none. It's all about the research.
Yes.
Prove the efficacy, everyone will be on board.
Are there any research that has been more important than another?
It's a great question. I think we just launched a research paper just before Christmas, which you can get on our website. And I think the reason that was so important was because it was the first one that we really did as a group of people from the start all the way to the finish. And at the very beginning of the research project, it was so important to make sure that we had a statistician on board to make sure that it was statistically significant.
And
You
ethical.
know, and ethical. The documentation was kept correctly. You know, it was able to be interrogated at the very lowest level of detail. And then there was a fair investment financially as well to ensure that it was published in the correct journals and available to everybody. In research pieces, often they go into sort of the medical journals and research journals, but they're not open and available to everyone. So that was really important to us. It cost us a bit more money, but it was really important because Reiki's for us all, that it was open and available to everybody. So that for me, I think, was the most important one that we've done so far. We've got several still going on where we've got hospitals that are.
That's exciting,
Yeah.
I think. It's the hospital research. So that hasn't concluded yet, but when that becomes published, having been part of that and seeing the evidence to date, it was so positive. There really weren't any black marks against Reiki whatsoever. Because there's no contraindications, it was just used across every ward, every patient, and everybody reported it was a really successful treatment, you know, every single time. So let's look forward to that research.
Yeah. So which stakeholders should be involved early in the process, as we are early in the process?
Every country's going to be different, aren't
Yes,
they?
of course.
We were lucky that the CNHC existed. I don't know how we
Yeah.
got through without them.
We haven't got anything quite like that.
You see, we also,
Yes.
the Reiki Fair is also part of the only organisation to be part of the government group representing Reiki. So if we want to make changes at a government level, we're in.
Wow.
But again, if the CNHC hadn't existed, how would we have knocked on those doors?
Yeah.
I don't know how we'd have done it.
I think over in Sweden, obviously you have the Chamber of Commerce is quite instrumental, isn't it? And I think, you know, as Anne-Marie said, every country's different. They've got their own
Yes.
structures, but I think it's really important to get in early with the people that make the decisions. You know, and it's for us when the core curriculum was created, it was really about trying to understand what the concerns were. So, you know, if you can better understand what the potential concerns are, it makes it very easy to wrap that into your document and your planning and your process. Because the worst thing you can do is develop something solo and then they go, oh, that wasn't really our problem, we're worried about this, you know, and it's.
It took a long time
Yeah.
though, really took years to get to this point.
And it was Prince Charles, wasn't it?
It was.
Still as a prince, absolutely.
It
yes.
was.
Yeah.
Yeah.
Of course.
I wonder if Reiki is recognized, other healing forms, are they also recognized?
Yes.
Everyone?
Not everyone.
Not all of them,
no.
but many.
Yeah,
The
many.
CNHC represents 16 therapies.
Okay.
And
For how long has it been recognized Reiki?
it's 2009.
Okay, not so long then. No.
Not at a government level. It was recognised before then,
Yeah.
but at a government level it was 2009.
But then they had other complementary methods in, yeah, and we have nearly no one complementary methods in Sweden in the healthcare. So it's rather different.
Yes, absolutely. I mean, you know,
It's difficult to come up with Reiki as the first.
Yeah.
I think massage was the first therapy to be recognised in a
Yeah.
hospital setting. That paved the way. And then
it's not
acupuncture,
Mm.
aromatherapy, and then Reiki.
Mhm.
Now it's
Okay.
mainstream, but it wasn't. Massage was definitely the first.
Yeah.
Funnily enough, Swedish massage.
ironically.
Yeah.
Yeah.
Also in Swedish massage. Yeah.
We have tactile massage. That
Yeah.
has been
Tactile
recognized.
massage, yeah.
And mindfulness we also have.
Mine.
Yeah.
We've got that now, but that wasn't the first.
Yeah.
Yeah,
Okay.
basic.
Mhm.
So in Switzerland was the same thing. To get to the level of the government, it wouldn't be possible to go only with Reiki. So it's actually the government asked, opened the possibility to send descriptions of the methods, and so that's how it worked. You know, it's kind of a 20 different methods have been recognized, and I think that's a way to do, you know, to try to find maybe massage associations or mindful associations, and create a pool like you had it in England.
Yeah, that's very good.
So most people that go into hospital in an NHS hospital are offered complementary therapists as a norm.
Mm.
There's always a team.
Mm.
And the word that's used now is not so much alternative
Never.
anymore. Never
Complementary.
use alternative.
Yeah.
Complementary or traditional
No, complementary in England.
Yeah.
in England, and on the level of the Europe, it's gonna be traditional also, to include anthroposophy.
Okay.
Maybe.
And what about formal record keeping or documentation? within
Always take a
healthcare?
client consultation.
Mhm.
Always.
Yeah.
In a hospital setting, it's even stricter.
Yes.
And I think the important point, we were talking about this at lunch actually, so each of the settings, so whether that be a hospital or a hospice, obviously they have their own guidelines and their own rules. Now obviously the NHS have, you know, rules from the very, very top, but there is a certain amount of interpretation, different computer systems, etc. But obviously we work with all of our practitioners for best practice, so we have, for all of our members in the back end of our website, we have examples of client consultation forms, details about how to keep records, you know, whether they're digital or whether they're, you know, paper, how you lock them away and keep them safe. So, you know, again, it's all about those standards, and you don't have to do it our way, but obviously we have our GDPR guidelines, etc. So we try and advise and guide and support our members to better do
But
those.
different hospital settings will have their own criteria.
Of course.
And I was explaining to you, wasn't I, as a nurse, I think you were quite surprised when I said we used to fill in the hospital doctors and nurses computer system.
Oh, wow.
It wasn't just scribbling a few notes, we actually used the hospital setting. We had to have all the training for that. So, you know, we're being treated as front, again, and I haven't said this, in COVID, CNHC verified practitioners of all disciplines were redefined as frontline workers legally, and that they haven't removed that. So now you can go into a hospital as a frontline worker. That's the equivalent of a nurse, junior doctor. That's amazing.
And it meant that any of our members that had their CNHC verification were able to work
During COVID.
throughout and during COVID. You know, obviously with the correct, you know, there were
PPP.
every week the CNHC were releasing, and then we were supporting our members with it. So additional guidelines and advice on how to practice safely, but it meant they were able to practice, and actually that was so important, both from a medical point of view, but also from a financial point of view, people could keep their livelihoods when it was so difficult for so many.
Yeah.
So that's another really, really key benefit.
Yeah, it's huge.
Do you have any other questions from the audience?
Yeah, I have one.
Mm.
You're in healthcare now. What's the next step? I think.
Schools.
School. Yeah, exactly. What
It has been in schools. I've taught lots of teachers Reiki in the past, but it's not mainstream yet. In Portugal, it got to the point where Reiki was quite mainstream. I don't know if it still is, but if we could have it in schools, our schools are in desperate need of it.
Yeah.
That would be fantastic.
I used to work as a teacher, so
Right, so you know.
that's why I asked. And if we could help our kids,
Yeah,
we're gaining so much.
Yeah.
definitely.
For definite. I think one thing that's really important to say is whilst we're in medical settings, it's still really early days. We've got the acceptance, but it's still only a couple of handfuls of hospitals that are actively employing people frequently. There's still budget constraints in all sorts of places, so there is still a really big journey to get it into more and more medical settings. I think I mentioned briefly that we've got this thing called social prescribing. So any prescriber, whether that be a doctor or an advanced nurse practitioner, is able to prescribe Reiki, but it doesn't happen a huge amount. So it's still growing. It's getting better every single day. There's still a long way to go. So we've got an educational team. We've got a research team. We're working with schools environments. We're working with vets as well currently to get that into more animal locations. Again, we've got lots of, we call them animal Reiki practitioners. There's a separate qualification you can get for that as well. We've got dog groomers, lots of people that are specifically giving it, people that are working in dogs' homes or donkey sanctuaries. So that's really growing, but actually working, we've got a new piece of legislation for veterinary care coming into place fairly shortly, which we're hoping will help to get that to a point where vets are prescribing it too, but that's way further down the journey. So
It'll
those
get
are,
there.
those are probably our three key areas of extension at the moment.
Jails.
It's already offered in jails. Loads of prisons have Reiki. It's so accepted in the UK. It's everywhere. It really is. It's normal.
Yeah. But what level is needed?
Practitioner minimum.
Yes?
Yeah.
What about enterprises?
What do you mean by that?
I mean by human resources.
Like businesses.
Businesses.
Yeah.
It's in businesses.
Yeah. So there are already some businesses that are
Wellbeing
receiving
days.
it. Yeah.
And if you're CNHC verified, private healthcare covers treatments. So lots of workplaces encourage their workers to get treated.
In the same way that you'd have a chiropractor or a physiotherapist, you can receive Reiki in that sense as well.
We also have a question down there.
Yeah, you tell us that it's more and more mainstream and more and more accepted. But I wonder if it has ever been forbidden?
No, not that I'm aware of. It was taboo.
Yeah.
I mean, when I first learned Reiki 30 odd years ago, you didn't talk about it.
No, but it's not forbidden, law forbidden.
No, not at all.
It is here.
It's
in law.
forbidden?
Yeah, yeah.
Wow. Okay.
And that's a very big
That's a huge
difference.
stumbling block.
Not.
It was the
yeah,
same
I don't
in
know.
Norway.
It's forbidden in hospitals.
Oh, in
yeah,
hospitals.
Not otherwise.
You
Okay.
couldn't do it, in hospitals. You
Yeah,
couldn't do
right.
it even if you did it for free. You're not allowed to do it.
It's never been forbidden, no.
Okay, that's a very, very big difference.
And you talked about background controls. What do you mean by that?
So the background checks.
Yes,
So we have it's called the DBS in the UK. So essentially that's a police check. So we can work
Yeah.
with companies that can go and do that. So we have essentially 3 levels that are available, and we are working with a partner organisation that can do that for all of our members. Again, it's not a legal requirement at the moment, but it will be in some school settings. It will be in certain NHS settings.
Yeah. All NHS settings.
Yeah, so we have that facility available, which just helps people with that extra credibility to be able to go, look, I've got this, it's all good.
And then you have a minimum when it comes to insurance as well.
Yeah, so all of the, because again, it's so mainstream with our insurers being very familiar with it, I think it's £6 million is the was the top level that we offer with Baylands, and then we've got
That's top level, yeah.
and then a £4 million, which is our lowest level, and that's pretty standard. So that's the amount of public liability as well as the coverage that you need. But again, because it is so mainstream, most of the common and well-known insurance companies will offer a complementary therapy style insurance. You sort of go on there, you can click the drop-down list and choose, Reiki, and apply for your insurance as easily as you would for your car insurance or your home insurance. It's
It's
very
that
good.
common.
Yeah.
Thank you.
We
Any
will
more
all
questions?
go and travel to England now. You're going to practice in
Yeah,
do
do
it.
it. Yeah, you're very
Do
welcome.
it. It's so accepted.
Okay, let's see how this goes in English. So what do you think is like the main difference in mindset that makes some countries maybe more accepting towards Reiki healing?
I personally, I don't know if there's a difference in mindset. I think it's just, probably tenacity and time. So we've obviously got a very well established National Health Service in the UK. It's sort of one of the originals, so it's had sort of a longer period of maturity, and there have been all sorts of different groups that sort of came together. So I think it's less about a mindset, it's more just it's been longer. So this group came together, the CNOC, in sort of those mid-2000s, culminating in our core curriculum in 2009. Most of the other European countries don't quite have that yet. So I think it's less about an attitude, it's more just about the fact that we've been plodding away at it for that little bit longer. So it's just reaching maturity a bit quicker.
It was hard work.
Yeah.
It wasn't an easy road, but now it's the norm. You forget about the hard times.
I think the different attitude is here in North. Norden, we have always been very late in this complementary or alternative medicine. Also in Norway, Sweden, Finland and Denmark. We were latest in Sweden to say yes to acupuncture. And even now we haven't allowed it fully, only for pain, not for anything else. So we are very late.
One of the key things, we had to take the word alternative out.
Yes, it's complementary.
Because it's got to be seen as complementary.
Yes.
And it was actually, it's treating people with cancer that was the breakthrough for Reiki.
Yeah.
It was going onto the cancer wards and people benefited from the peace they got from it.
Yes.
And I think referencing my point back earlier on, and it relates to that same thing, it's working with those sort of government-led and central organisations, because the point about alternative was such a key point. It sounds like it's just a word and we're just swapping it out for complementary, but actually the fundamental point was, no, this isn't instead of a doctor. You still need to have your medical professionals, and we advocate for that throughout. But actually just that one word was almost a deal breaker for them, and by switching that and getting everyone working together and understanding it's an as well and it complements rather than this alternative was vast. And if we hadn't understood that in the early days, we'd have probably never got to where we were.
It's true. And then the other thing, the core curriculum states clearly that there's no known contraindications to Reiki. That was a big deal breaker. Once the NHS accepted that there were no contraindications, they couldn't stop people being treated. It didn't affect any illness. But in England, we used to have a long list of contraindications. I don't know where it all came from. It's all gone now.
On the level of language, there is also the word of integrative medicine, which is
Integrative medicine,
yes. You would say complementary therapy and integrative medicine.
Again, integrative medicine is not used in England anymore. It used to be.
You are not using it anymore. You had bad feedback on integrative.
The word is to use is complementary, full stop. So that's all we use.
It's because on the European level, it's really going into integrative medicine.
It's not going to happen in England.
It's interesting to know that, it's different.
Yeah, for
countries.
sure. And I think that's just a perfect example of how it's about understanding sort of the touch points and the worries that each of the individual areas have, because at the end of the day they're all just words, and it's about finding the one that best works, and you know,
In your country.
Yeah, exactly that.
So is there anything you want to add also that we haven't asked about? I'm sure you can.
I don't know, to be honest. Yeah, I mean, absolutely, we could probably talk about it forever.
Yeah,
We'll
I
we'll
think
bore
so.
you all some more over dinner. But no, very comprehensive questions and added to by the room. So yeah, I haven't got anything else to add. But thank you everyone for your questions.
Well, if no one has any more questions, no?
Maybe I have one question.
Oh, yes.
Because, for example, in Austria, acupuncture can be practiced only by doctors.
Yeah.
And it happens mostly that when a complementary method gets acknowledged, then only medical doctors can use this practice. Massage has been also not done just by doctors, but almost. What would you give us as an advice not to fall into this trap for Reiki? Because people had invested a lot of time, money, passion in education. And
Yeah, I mean, it's a great question, and it's not something I guess we've ever had any experience of. I mean, in the UK, you know, we've got all sorts of challenges around not having enough qualified doctors at the moment, and I don't think it would ever be a possibility for them to have enough time to be able to add something else to their repertoire. So it's a very different challenge for us in the UK.
But in the UK, all doctors, there's 23 training schools for doctors, they all have to learn complementary therapy in 3 months. Most of them choose acupuncture because they can use it as a medical acupuncture, but at least they're introduced to Reiki and other therapies, which is excellent.
Yeah. And again, you know, the more understanding they've got, the better. So, I mean, I think our challenges are probably different to the ones that you'd experienced. But again, I think as more and more of these complementary therapies become possible and widely accepted, it's impossible for general practitioners to know all of them. So I guess my advice would be try and get loads piled in so they can't possibly learn them all.
thank you.
No more questions? Get your chance. So thank you very much.